1202, Chapter 32, Women's Health Care. We have a Women's Health Initiative that began in 1991, and it has progressed since then with more focus on women's health and women's health issues. Mostly cardiovascular disease has become a big in the forefront. Unfortunately, women are smoking, they are overweight, they are sedentary. We have family histories, etc., that put us at risk. Breast cancer is also a part of this focus on preventative health, osteoporosis, and there are 13 new topics, Healthy People 2020, which is now a little obsolete, but still in focus. You can find this if you Google Healthy People 2020, you can find more up-to-date information. I'm scared that this might be a little outdated. Health maintenance is very, very important that we promote health and health maintenance, examinations and screening procedures that help us detect things early for certain things like breast cancer, cervical cancer. Breast cancer would be mammography, breast self-exam, exam by a provider. Cervical cancer, of course, being with pap smears as indicated. And once we find these things, we can get treatment started, hopefully have a better chance of survival and long-term survival. And sometimes women just may not be aware of health maintenance procedures or what might be available in their area. And so this is something that we would be able to help them, put them in touch with resources and so forth. We will go ahead and revisit the breast self-exam. We talked quite a bit about this in health assessment. As you see here, it says do once a month, a week after your period. Some women wait like the 7th day after their period started. There's no hard and set rule. You wouldn't want to do it before, you wouldn't want to do it during as it's ending, or maybe a little while after, just so your breasts are not so tender and you can get a better exam. This is the lithotomy position that women have to lie down and do this as part of a pelvic exam, vaginal ultrasounds, etc. And they do this for pap smears, gynecologic examinations, some gynecologic procedures, even surgeries use the lithotomy position. And in childbirth, the head of the bed is elevated, but their legs are in stirrups, as you well know. This is a bimanual exam. The examiner inserts one hand with 2 fingers into the vagina, and then externally palpates above the symphysis pubis for the uterus, and can also palpate the ovaries. And it's PELVIC, no E on the end of it. Sorry about that. These are vaginal speculums. They're either plastic or metal. The metal one can actually be warmed in warm water so that it's not quite so uncomfortable. So when we're talking about women's health, menstrual cycle disorders are part of that as well. Amenorrhea, which means absence of menstrual periods. Primary usually is because of pregnancy. Can also be hormonal issues, can be even stress, depression can have an effect on it. The secondary would probably be that as a result of hysterectomy. Lots of times young girls who are involved in very strenuous sports workouts like gymnastics may have delayed onset of menstrual periods, also known as menarche. So anything that would cause any concern to your patient would need to be evaluated probably. Abnormal uterine bleeding, also known as dysfunctional uterine bleeding, often occurs as a result of possibly menopause approaching. Could also be other problems as well. You might have more bleeding than usual, may last longer than usual, have more amount. It just depends on what's causing it. Could be a fibroid in the uterus. Again, mostly associated with a menopause, but also some sorts of cancer. So it needs to be at least looked into, and it could be nothing, but we would want to encourage our patient to go seek some evaluation. Pain associated with the menstrual cycle. Mittelschmerz is known as, some women can actually feel when they are ovulating. It gives them a little pain. Primary dysmenorrhea, that means painful periods, cramping, terrible cramping, backache, leg pain, vomiting, nausea, diarrhea, heavy flow. Can be caused by endometriosis, which is an abnormal growth of endometrial tissue outside of the endometrium. Dyspareunia is known as also painful intercourse. And again, endometrial tissue outside the uterus is called endometriosis, the endometrial tissue. Premenstrual syndrome is something that we talk about. We may joke about it, but it is a very real issue with some women. Major symptoms of endometriosis is dysmenorrhea, very painful periods, terrible cramping, low back pain, feeling of deep pelvic heaviness, painful intercourse, terrible periods. Okay, just really awful, very painful. Sometimes women are actually, they have to call off work, they have to stay in bed. We can use drug therapy. Sometimes it does respond to certain drug therapy, which I'm not going to get into today because that'll be another class session. But sometimes they use oral contraceptives, sometimes they do other things. And then sometimes may require surgical intervention by, they may go in and remove some of the issues, the lesions. If it's extensive and they're really concerned about cancer, they will actually do a hysterectomy. And so a hysterectomy is a surgical removal of the uterus to treat cancer, dysfunctional uterine bleeding, or abnormal uterine bleeding, endometriosis, non-malignant growths like fibroids, persistent pain, pelvic relaxation and prolapse, and previous injury to the uterus. So a total or a radical is removal of everything. Total could be, partial could be just the uterus and then leave the tubes and the ovaries, especially if it's a younger woman and they want her to continue to have those hormones that the ovaries secrete. And then there's different ways it can be done. It can be laparoscopically, it can be done vaginally or abdominal. And if it's done either way, laparoscopic vaginally or abdominal, but particularly laparoscopic and abdominal, you're going to employ all your pre and post-op nursing care measures. She may also wear a pad and have a small amount of vaginal bleeding, just because of the surgery procedure itself, but it should not be heavy. And in your care of your patient following a hysterectomy, here are some common but not an all-inclusive list of nursing diagnoses: anxiety, disturbed body image related to altered fertility, and fears about sexuality and relationship with partner and family. And we need to dispel the myth that a hysterectomy obliterates sexual desire in the female. That's not true, particularly if their ovaries are still intact. Some women actually have an increase in libido because they're no longer worried about getting pregnant. So, but we need to dispel that myth. Acute pain, of course, could be an issue. Deficient knowledge, there's several. So these are just a few. So here's a calendar for PMS symptoms, and sometimes women are actually asked to keep track of these things so that their healthcare provider can actually see when their worst days are, and weight increase, and you see a bunch of them here: headache, bloating, insomnia, irritability, depression, etc. There's a scale: none, mild, moderate, severe. So if the woman can keep track of these and kind of know when things are coming, and she can maybe get some antidepressants, different things can be tried for PMS, and you need to read about that in your book. Would be a good idea. So here's the symptoms and how to take care of them. Diet. There's several things here. You've got reduce consumption of caffeine. That'd be coffee, tea, colas, chocolate. Oh my. Avoid simple sugars like cake and candy. Decrease your intake of salty food. Drink at least 2,000 milliliters of water. We do that 6 small meals is better. Avoid alcohol. Increase your physical exercise if you can. Stress management, sleep and rest. All those things can be good things, but again, sometimes they might need a sleep aid. They might need an antidepressant. It just depends on the severity of their symptoms. And we'll talk about induced or elective abortion, which is the purposeful interruption of pregnancy before 20 weeks of gestation. Nowadays we have partial birth abortion, where the child is completely full term and they murder the child as it's being born, but we won't go into that. But it's a purposeful act. Medical methods include that first 7 weeks. Within the first 7 weeks of that last menstrual period that was missed, we can use prostaglandins like misoprostol and other ones that you see listed here. Methotrexate. They'll just induce miscarriages, basically abortion. Surgical methods, after they're more than 7 weeks since their last menstrual period or a failure of medical abortion, they may do vacuum aspiration with curettage, dilation with removal of the fetus and placenta. That will come later. That's a later in the first trimester, toward the end of the first trimester, like maybe weeks 11 or 12. But before that, up to 7 weeks, they will use the medical methods if at all possible. And then self-care, avoid strenuous work. Bleeding or cramping may occur for up to 2 weeks, so they'll need to wear pads. No tampons, no douching, no intercourse for at least a week. Sometimes docs say longer than that. Take the temperature, resume birth control measures. Do not miss follow-up appointments if they start having foul smelling vaginal discharge, having some really bad cramping. Let's see. Really bad cramping, heavy bleeding, chills, fever over 101. All those would be signs of complications and should be immediately evaluated in the ER or something like that. Menopause, complete cessation of menses, which is a normal sequence of life. It happens to every woman at one point in time or another, whether it's by a hysterectomy, which is called surgical menopause, or by natural means. You see here all of the physiologic characteristics. Menstrual cycles increase in length. Instead of being every 28 days, it may get longer and longer between. Ovulation doesn't occur as frequently. Progesterone is not produced. FSH, follicle stimulating hormone values, are elevated, and it's trying to stimulate them, but it doesn't work. So it just secretes more and more hormone, but it's not responding to those. The ovarian follicles are not responding. Physical changes, bleeding, they can have spotting or heavy bleeding, it just depends. Irregular bleeding. Genital changes, that means that the labia become more flabby, the vagina and the cert is more dry. There's dryness with intercourse. There's not as much vaginal lubrication. Vasomotor instability, hot flushes, different. Mood and behavior, irritability, moodiness, crying, temper, etc. And they are very real, and they are caused by hormone imbalances, not because someone's going crazy. So it's the risks of perimenopausal or around menopause is osteoporosis, coronary heart disease. They may decide to give hormonal therapy as part of treatment for these two things, but we have to make sure that we screen these patients carefully. They cannot have any history of thrombophlebitis, thrombosis, stroke, high blood pressure. There's a lot of things we have to evaluate to decide if they are safe. There are many side effects. They can actually have spotting, they can have breast tenderness, headaches, etc. So there's different ways that they can be treated. Some women just decide not to have treatment and go through it. Sometimes there's herbal different methods that can be done. So there's a lot of stuff out there. Osteoporosis is, decreased bone density, and it's all because of the decrease in estrogen, which accelerates bone loss, which makes them more susceptible to fractures. And risk factors, if you're a small build, Asian, just white, I think Caucasian, if I remember right, but anyway, there's several risk factors listed in your book. Manifestations, you know what those are. Posture, the kyphosis there. Okay, so she was 5'6", and now she's down to 5'2". She's lost 4 inches on her height. Menopausal therapy, hormone therapy, estrogen and progesterone is given to the woman who still has her uterus, and then estrogen to those who have a hysterectomy. But again, they're very selective on who they give them to because of the risk of breast cancer, clots, stroke, etc. Breast and uterine cancers, I should say. Okay, through the process of time, being overweight, having multiple children, weak pelvic floor muscles, a woman can actually have what's called a uterine prolapse, which the uterus can slip down into through the cervix. Well, the cervix is actually part of the uterus, but it can slip down through the vagina, the vaginal canal through the vagina. It can actually protrude outside of the vagina, which is very, very troubling and embarrassing and needs to be evaluated. They may do a hysterectomy. They may do something else. A cystocele can be helped, which is a bladder protrusion, bladder prolapse, can be used with a vaginal pessary, which helps hold it up. Surgical repair, lots of times with both of these, with the cystocele and the uterine prolapse, women can get incontinent, urinary incontinence. And you see here how they can differ, how they, third degree, as you see, the cervix extends out of the vagina. So that definitely needs investigation. Okay, we're going to go on through, we're not going to talk about this. These are symptoms that must always be investigated. It's a good idea to know these. Very, very important to know these. And these are all your infectious disorders. Even though candidiasis or yeast is transmitted by sex, it's not listed as an STD, but it is. Trichomonas, bacteriovaginosis, those are all passed from one partner to another. Chlamydia, and on this list, chlamydia can be cured. Gonorrhea and syphilis, it may go away, but I don't know that you're completely ever cured of syphilis. I can't remember. But we know herpes you have, HPV you have, and AIDS you have. You can have a vaccine though for the HPV because kids are having sex at a younger age. They recommend that they have the HPV vaccine at age 12. Pelvic inflammatory disease is often associated with having STDs frequently. Also, the insertion of an IUD can predispose the woman to the risk of pelvic inflammatory disease. Chronic pain, that lower abdominal pain, is one of the things. Maybe some vaginal discharge can be part of it. Toxic shock syndrome. It's not very common, but you see here the high absorbency tampons, failure to remove them, using double tampons, and then even using a diaphragm would be contraindicated for this person, because once they've had it, they really can't do those things again. They cannot use those devices.